Aloha. My name is Lauren Nosworthy, and I am a current MSW candidate at Hawaii Pacific University, participating in the 2022 Capstone Symposium. My capstone project is a systematic literature review on the role of social work in the opioid crisis. This is something I'm super passionate about, and as you can see throughout the presentation, you will see a theme of the color purple, and that is because purple is the overdose awareness color. And before I go any further, I would like to have a brief moment of silence for those who passed away due to an overdose and are no longer with us today. Thank you. The opioid epidemic is a national crisis that has been going on for many years with significant impact on the macro, meso, and micro level. In the last 30 years, almost 841,000 people have died from drug overdoses, and in 2019, over 70% of those drug overdoses involved an opioid. Opioids are known as a pain-relieving drug that also produces euphoria and is highly addictive and is easy for those to overdose when consumed. Opioid overdoses have claimed the lives of over 94,000 individuals in the United States during 2020. Multiple health professionals with different educational backgrounds and different career objectives, such as doctors, nurses, and social workers, have played a unique role in this crisis. This systematic literature review assessed what published research accurately demonstrated the role social workers have played in this ongoing crisis. There was a total of 20 articles included from 32 different databases and search tools that had the criteria of being held by the Hawaii Pacific University Library, peer-reviewed articles, publication dates between 2013 to 2022, and also presented in the English language. This is a chart of the keywords that were typed into the search bar. There was a combination of multiple words, whether it was opioid and social work, opioid and social worker. You can see how just the small changes, there is a big difference in the results shown. And as you can see here as well, opioid and social work and also opioid crisis had over 300 results that came from the search, but very few or none were actually included from the results. So this graph shows the light blue of the number of total results showed from the search, and then the dark blue is the number actually included. And of those 20 articles that were included, the main themes that came up and the results essentially implicated that there's very little research and resources on the role social workers play in the opioid epidemic, but the themes that were common from the literature consisted of a need for more curriculum and on substance abuse and opioid use disorder, more education treatment training, and also taking a more macro approach when working with those struggling with opioid use. On this screen, you can see this is just two of the articles displaying the themes of a need for more curriculum in regards to substance abuse, and also a training program that was implemented known as the I-Peer program, which is the Interprofessional Peer Education and Evidence for Recovery. So these were two articles that were very useful and showed great examples of how social workers can make an impact in the opioid epidemic. And these are two other articles out of the 20 that were selected, again, implicating that there is just a need for more training and more education. And also there is a need for taking a macro approach, because the macro approach is working in communities. And on the left-hand side, on the top, you'll see a little blurb known as the Imani Breakthrough Program, which took a culturally responsive approach and worked with the 8 dimensions of wellness. And in the highlighted picture below there, it displays the 6 main themes that came from the impact of the Imani program on participants struggling with substance abuse. And on the right-hand side, that's just another blurb from another article demonstrating how educational opportunities for social workers have been developed to enhance and train new social workers to improve their skills. And also that there is a need to include peer and community support, because across populations of people from youth to families, churches, primary care centers, community health clinics, there are models being developed to enhance our capacity. So these 4 articles that I talked about here are just included in the other 20 that also, again, follow along with demonstrating the common theme of there's a need for more curriculum, trainings, and also for taking the macro approach. This study had limitations, as all do, and the 2 main limitations from this study included 1, time constraints. This was a semester-long research project, and potentially with more research, more time, more research could have been conducted and more articles could have been found. Also, there was limited access to certain data. For some articles, I had to pay, or I had to be signed up with a certain school account, and HPU was not included in those schools that had access. Suggestions moving forward. From what came up in the systematic literature review, social workers are working on doing their part and they are making an impact, but we really need to focus more in on providing more curriculum around substance abuse. We need to better train our social workers before they're out in the field working hands-on. There needs to be training and more curriculum. And also when they're then through getting that training and that extra curriculum and working with clients, taking on a more macro approach to better help aid certain communities and certain individuals. And this concludes my capstone presentation, and I look forward to any and all questions. Thank you.